Hi Arzum,
Hi,
how are you?
I'm fine.
Yeah, Arzum is a very young patient of ours. Actually, she's the youngest of all. She's 15 years old. She's Australian born. She has Australian citizenship, but she's living in Cyprus now. And you were 15, right?
15.
And when did you have this obesity problem? When did it start?
I've actually been overweight since birth, and then
Yeah.
for the past couple of years it's been getting worse, and that's when I gained most of my weight.
Okay, so if you, think backwards, you would say that you were always dealing with this problem.
Yeah, I was always
dieting and
yes.
So what did you try to do before?
I had tried several diets, which never really worked out.
Yeah.
At one stage, I had tried to take a tablet for that.
Okay.
That didn't work either.
Yeah.
So then when I came here, the doctors had told me this is my last chance to lose the
So
weight.
when were you became aware of bariatric surgery? When did you know about that?
About a year ago.
About a year ago.
Mm-hmm.
And then you discussed this with your family, and
With my family,
they maybe also
yes.
helped you. And today, as you know, this is first day after surgery. You've been through a sleeve gastrectomy procedure yesterday, which went very uneventfully, very nicely. And now we're gonna do a filming. You're gonna drink some opaque fluid, and then we're gonna check whether you have any torsions or leakage stuff. Hopefully there's nothing wrong with you. And then today you're gonna start some oral liquids. And I'll talk to you later. Thank you very much.
Okay.
Take a big sip from that glass, please. Take a big sip, but don't swallow it. It shouldn't be too big as well, the sip itself. Okay. Olsun. You can swallow it now. Arzum, hi. How are you?
I'm fine.
Okay. So this is the second day after surgery, and you started oral liquids yesterday,
Yes.
actually. How many glasses did you manage to take today?
Around 2.5.
2.5. So we need you to drink at least 3 cups more until 12 o'clock at night.
Yeah.
And as you know, tomorrow is the discharge day. I'm going to talk to you shortly tomorrow as well. How are you feeling?
Good.
You've been walking.
I've been walking a lot.
Yeah. You had a little bit of nausea yesterday.
Yes, but it went away after about 10 minutes.
Yeah. So today it's better, right?
No, I haven't had any nausea today.
Okay. So if you think backwards, and if you went through all the steps and you had the operation as well, do you think it was a very difficult process, or?
No, actually it was very easy. You get very tired during the tests and stuff because there's a lot of tests you need to take.
Yeah.
But other than that, it's a very simple procedure and there's nothing to worry about.
Okay. So thank you very much for giving me permission to record you telling those things to other people. But that sort of data is very important for other patients, especially young ones. Thanks very much. We'll talk to you tomorrow again. Bye-bye. Hello.
Hi.
This is day 3 after sleeve gastrectomy, and today is the discharge day. we just discussed with Arzum about the upcoming diet protocol, or what can she have, what she shouldn't have. So we just want her to repeat us for today is the third day, so starting from today, I'll see you in about 3-4 days time. So how are you going to spend these 3-4 days in front of you? What do we want from you?
To drink lots of fluids, and
Yeah.
a couple of days to start eating yogurt, start walking around and be more active.
Yeah, that's very important. Do you know why is that's important? To be active, to walk around, why is it important for you? Do you know that?
No.
Because there's this probability that some clots may happen in your lower leg area, so it could be dangerous to you. Also, you will be doing every day one single injection, right? I will tell your father that he or somebody else will do daily injections until another 7 days after the hospital.
Okay.
Anyways, and I'll see you next week then. Okay. How do you feel?
Good.
Today we removed one stitch that we used to fix the drain. What are you doing now? What is our? I'm always talking this so that to make clear that you understand everything perfectly. So what is your diet now? 6 days after sleeve gastrectomy.
Basically things like water, juices, protein shakes. I have to drink those.
Yeah. So basically liquids.
Yes, liquids, just liquids.
But we already started to yogurt. You can eat yogurt. And also you can have some hummus. And starting from tomorrow, actually, you can change the liquids to thicker soups. We don't want you to drink lentil soup. The original Turkish lentil soup may cause a bit of gas. So well, you can drink it after 12th or 13th day. So next week, all week long, you have to have a lot of thick liquids. What do you need? You have to take care about when you're drinking those soups. What is that?
Oh, you have to drink it a little bit at a time.
Yeah,
and
exactly.
you can't drink it like right after each other. You have to wait.
Yeah, exactly. And then third week we will be starting puree form of diet. Generally speaking, especially for the first 6-7 months, also afterwards, we want you to have a lot of protein, a lot of fiber, and a low carb diet. And you should avoid empty calories all your life long. Anything which melts in the mouth is like forbidden, okay? This includes potato chips as well. Anything which melts in the mouth. Are you still having your injections, daily injections?
Yes.
And how long are you going to continue on that?
Well, I've been doing it for 3 days now. I have to do 7, so 4 more days.
Okay, and then you can quit that. Also you need to, what the other thing is, also you need to take vitamins.
Yes.
And some additive. We
yes.
already, what is that?
It's like a sort of tablet that.
No. I mean, the vitamins are fine. You're having some liquid vitamins now.
Yes.
You can also have the ones that melt in the mouth forms, that you can use them as well. But there is another thing that you have to add your diet every day nowadays. You know that. You should tell me that. I'm not going to say it. You're having your injections, you're having your vitamins, you're having some liquid diet, and there's an additive. It's a powder.
Oh, my protein powder.
So this means that you're not using it.
I am using it. I just didn't know
Are you sure?
Yeah.
Okay, that's very important, especially in the first 6 months. It is of uppermost importance because through normal diet, it's very difficult to give you enough proteins. That's why it's an addition to regular diet. After 6-7 months, that won't be that important, and you may not need it anymore. We'll decide on that together. Okay, and another thing, this is the 6th day after surgery. There is almost no risk involved now, but there is the slightest possibility that sometimes we see late leakages. which is very unlikely in your case, but if you have any newly starting abdominal pain, or if you have fever more than 38 degrees Celsius, then you have to inform us. You don't have to wait. Even if it's late at night, you can call us, okay? And okay then, so we'll make another video with you when you're a bit smaller, okay?
Okay.
Thank you.